Hi, my name is Schlosser and this is my presentation for the SIGCHI 2021 Doctoral Consortium. In my PhD research, I'm exploring head-worn displays for emergency medical services. I'd like to start this presentation by emphasizing some of the challenges that emergency medical services face in the pre-hospital environment. So they have to work in all sorts of different environments, ranging from rural areas to metropolitan centers. Also, they are exposed to changing weather conditions and have to work in the confined back of an ambulance or a rescue helicopter. However, maybe most importantly, accessing clinical equipment and clinical consultation in the pre-hospital environment is very challenging. Because of this, in previous research, other researchers have proposed that decision support systems and information exchange systems should be developed for paramedics and emergency physicians to support them during their challenging work in the pre-hospital environment. However, implementing those systems on handheld devices that have to be held in your hands is maybe not ideal, because oftentimes you need your hands in the pre-hospital environment to care for the patient or to carry out other tasks. Because of this, head-worn displays have been proposed as an alternative hardware platform to implement those decision support systems and information exchange systems, because they provide different features such as see what I see, so that a remote person can see what the paramedic is seeing, or continuous and integrated information access in a heads-up way. When I started my PhD, I looked at the previous literature on head-worn displays in EMS and I identified 3 gaps in the research. First, it is unknown which tasks in EMS could be best supported by head-worn displays. Also, we don't know how to design, especially for augmented reality and peripheral information display, heads-up displays, and it is also unknown what the exact effects are of deploying these devices in a pre-hospital environment. To address the gaps, I first conducted a literature review where I surveyed different head-worn display applications in the industrial environment, which is outdoor and therefore very relevant for pre-hospital care, and in the hospital environment, which is obviously also related to EMS. Through my survey, I found out that there are 7 different categories of head-worn display applications, which are manual work guidance, remote collaboration, recording and preservation, monitoring and notifying, capture and analysis, understanding and visualization, and controlling. Next, I conducted some field research with Retrieval Services Queensland, who are the aeromedical care providers in the state. I accompanied the crew of Rescue Helicopter 500 and tried to learn more about their work practices. Together with them, I identified 3 use cases for head-worn displays in EMS, which are remote collaboration support, for example during a situation report with the clinical coordinator who is responsible for all retrieval missions here in the States. And if you want to learn more about this particular use case, please watch the other video that we prepared for SIGCHI 2021, where I exclusively talk about this field research. 2 other use cases that emerged during the field research were also monitoring of vital signs and training support. In the next phase of my PhD, I addressed some of the issues related to head-worn display application design, and I came up with an activity where participants link 2 different cards which represent challenges during a mission and also features that a head-worn display can provide. In the final phase of my PhD, which I'm planning to conduct in the second half of this year, I'm planning to evaluate some of the head-worn display applications that we have developed in collaboration with EMS participants and want to find out how they could potentially affect patient outcomes and also the workload of the wearer of the devices. If you want to learn more about my previous research, please consult my other publication here at CRI 2021 and the literature review that I published in the International Journal of Human Computer Studies.